As we said a few minutes, ago, we're going to renominate the animal inspector and her assistant, Kayla Preventure and Javon Kowalski. Any thing in favor or against that?
No. Just, do I need to motion?
Yeah.
Okay, motion to renominate, reappoint, or they're nominated.
I'll
Reappoint.
second.
Okay.
Okay. Now we have the famous bodyguard.
All right, so first, there were two questions that came up with this. I think first we'll start with the lip pigmentation. And so we had one of the body art practitioners, Lauren, who works at Mirror, had asked because she's going to be taking, or she wants to take a class on lip pigmentation, and it wasn't clearly defined in the regulation. So I said she wanted to know before she went and paid all the money and took the class, if that was something that she'd be allowed to do with her body art practitioner license. And I've invited her here, and I can see her in the attendees list, so I can promote her to a panelist so that she can answer any of your questions, because I know you guys had some. So let me just promote. All right, so I don't know if Lauren, if you want to explain a little further, or if you had any questions.
Zoom.
Hi, Lauren.
Hi.
So if you can go over first, when is your class that you're taking?
I haven't yet signed up for it. They have them like throughout the year for different services, basically.
Okay. I don't know if I could personally make a decision today. It would be good to just find out what you're talking about and then like evaluate it. But if it seems completely different from the other stuff, it just seemed like you were talking about microblading on lit, and so that became confusing. So go for it.
So what you're probably picturing is the actual micro blade that I'm using to cut the hair strokes into the skin. It's actually a different needle that we use for like powder brows. It comes on a machine and it has a safety cartridge. So the needles go in and out of the safety cartridge and poke holes into the lip, basically depositing pigment. It doesn't go further than like that first layer. So it's not permanent, it's semi-permanent, kind of like the eyebrows.
Okay.
So it's not fully like a tattoo, it's permanent makeup.
And where on the lip? Everywhere on the lip?
Yep, so it would be like the lip line and the entire lip.
Okay.
My school that I had reached out to, that I took the initial microblading class with and certification, offered to have any like fill in the blanks for you that you had any questions with also. So if you wanted to get my email from Michael and then kind of list off what you need and what you need to like understand basically what it is to okay it, then I can pass that along to them and then get back to you with that.
Thanks. Yeah, because microblading I'd heard of, and you know, skin is different than mucous membranes. I just want to make sure there's going to be nothing that comes back and bites us.
Yeah, I have a lot of paperwork that covers everything.
Okay, great. Thank you. That would be great. I can, Michael, even if you drop it off at the public health office, I can go and pick it up. And
Drop off.
paperwork.
Okay.
Explanation.
But yeah, like what
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 it
explains-
entails.
Okay. Yeah, I'll reach out to the school. I'll have them give me like A to Z, and then I'll drop it off with Michael.
Is that okay, Michael?
Yeah, that's fine.
Okay.
And then I can scan it and send it to you guys.
Thanks. Not to give you one more thing to do.
That's fine.
Do you want me to exit out now?
Yeah, we'll probably have you back at our next meeting where a final decision will be made.
Rob, do you have any questions? Is she gone?
Yeah,
I can promote her back up if you have more questions. All right, so then second piece of the body art regulations that were up for discussion were we have Leah Lynch from Boutique, and she has, I think I possibly maybe explained this a little bit in my email. There were two, I just want to make sure I say it right. There were two questions in regards to this. One was she has a practitioner that doesn't have 2 years experience and was wondering about apprenticeship. I know that was something that was maybe lined up and then the regulations might change. I'm not 100% sure since I wasn't here when they were created. And also substituting a course for the anatomy and physiology requirement. So I'll promote her so that she can explain more on that.
Can you hear me okay?
yes.
Okay. Yeah, I'm actually excited that Lauren was on the call too, because I know that she had received one of the first licenses in the tattooing version, like the machine version of the cosmetic tattooing. So I'm really glad that she was here and able to explain that. We are interested in the fact that I'm looking at the paperwork now, and up until this point, there hasn't been any issue with needing to have somebody be able to receive their license and start practicing on models to be able to become proficient in the service after their training. And I'm just curious as to how I can attain the apprenticeship license that would be required prior to, or a deeper explanation as to what the 2 years of experience would be, and in the past if that's been required of others, because I know that it hasn't been an issue in the past, so I'm just curious about that.
To be honest with you, since we passed that bill, there's never been an issue. Whether or not people have been brought up through the ranks and we weren't made aware of it, that I don't know. But there hasn't been any issues, complaints, etc., since this has been enacted.
Awesome, great.
Just to clarify, those are just state regulations that we signed on to, community regulations, right?
There were
Robin?
model regulations that were originally brought up, and then it looks like they were revoted on and updated in I think 2019.
Yeah, we put on a few local addendums to it, but basically it was the state regulations.
Well, the state doesn't have a regulation. It's city to city that makes those determinations. So I'm just curious as to, there's obviously a change that I wasn't made aware of. And I have someone on staff at the moment. And if the new requirement is that there needs to be an apprenticeship license before the master license, if you will, I'm just curious as to how I could apply for that, because there is no application for that, although it does reference the apprenticeship license on the document for the regular licensing.
I don't remember that, quite frankly, at all.
Okay, it might just be, I might be confusing myself as well, because it has never been an issue in the past. So I'm just going to get all the documentation that I have together for the new artist that we have that's just completed her certification and bring it down to you guys the way that I normally have.
Yeah, that sounds about right.
Okay.
And then
All right. Thank
the
you for
question-
clarifying.
Did you have the question about the anatomy and physiology?
I actually had a question about the anatomy and physiology course, because I do believe in the past that the Catherine Hines aesthetic curriculum was one of the alternatives that was listed, but it doesn't specifically list what the alternatives are for the anatomy and physiology 1 and 2.
I would say just stick to what's in there. It's safer than,
It does reference, it says anatomy, physiology 1 and 2, or a Board of Health approved course. And I do have an email from the past from Frank, who I had already asked this question in the past, if the Catherine Hines curriculum was going to be and it would suffice. It's a 300-hour curriculum on skin, and it goes into everything that has to do with skin. And it was approved at that time. That he did say that that was acceptable based on taking the Catherine Hines actual textbook and taking a look at it and seeing what was included in it. And I do have those past correspondence, but that was from Frank. So when I was trying to clarify, I realized that there's been a change in management, if you will. So I just was trying to clarify if the Catherine Hines Institute curriculum would be acceptable as an alternative to anatomy and physiology from a college course, which is a little unattainable.
And Frank approved that?
Yeah, I do have the correspondence of when
Okay,
we
no,
talked.
no, my point is, if a past director approves something, it carries through
Okay.
unless there is something that would overturn it.
Okay, awesome. Thank you for the clarification on that too. And I did have a curiosity as well about the micropigmentation for the lip, because that is something that we intend to be able to do. The particular piece of equipment that we use in which to do that is the same as you would use for the powder brow. It's just being used on a different area of the face. So we're following all the same sanitary procedures. It is not a cutting of the skin in the same way that microblading would. It's just a light kind of scratching of the skin, and where pigment would then show up onto the lip area. So it's a fairly non-invasive and non-permanent procedure. And we are also hoping that we would have the ability to provide that service.
Well, in all probability, a decision will be made on this at our next meeting, because
Okay.
we are going to be provided with some more information so that we can make an informed decision.
Okay, thank you so much.
Thank you.
I believe that Lauren was going to provide that documentation that was necessary for that, but let me know if there's anything else that you needed from me.
Okay.
Thank you.
All right. Have a good evening.
You too.
Okay. So do we have a COVID-19 update?
Just a quick one, just figure I'd give you the numbers for March so far. We had 22 cases so far this month, 0 deaths. So already starting much better than January, and much better than January, much better than February. Our percent positivity as of today is down to 1.55%. And we have 93% of individuals with at least 1 dose, 83% fully vaccinated, and 43% with booster shots. So
Okay.
What's the delta on the booster, Michael?
what was that? Sorry, didn't hear.
What's the delta? What's the difference from last time you gave us on the booster? Is that gone up, or is that the same?
I think it went up 1%.
Okay, thanks.
It's over the past couple of months, it's slowed down heavily, and it's been going up by like about 1% every couple of weeks.
we gotta promote boosters.
Yeah.
Yes. But I did hear that Novak's vaccine hopefully will be coming out late spring. So that's a more traditional vaccines may be able to convince some holdouts. I don't know.
Yeah, and everything that I know Pfizer just came out with the news that they're looking at a booster dose in the fall for the seniors. And so I'm sure that will, more information to come on that, but I'm sure it will be a yearly thing like the flu for now. That's what it's looking like for now.
Okay. Okay. So unless there's anything else to discuss on COVID-19, we'll move on to the Choke Saver Program proposal.
Yeah, so this is one of the things that our nurse Pam has been working on. Currently, it's a requirement for any restaurant in Newburyport to have that has 24 or more seats to have one person on staff at all times who is trained in manual choke saving procedures. The closest class to be able to do that for just choke saver without having to get the full first aid CPR is in Salem, and it's about $36. It's about a 1 hour class. So to kind of help out the restaurants and to get more people trained on choke saving procedures so that the restaurants aren't just sending the minimum amount because it does cost money. Pam is licensed to train, and she came up with a proposal, and since we would be charging a fee, we thought best to bring it before you guys just to have a vote on it or make you guys aware. Essentially, the cost for one class is about $89. So the proposed rate would be, if you're a Newburyport attendee, $20, and if you're a not Newburyport attendee, $25. So we gain a little bit of profit to put more into more programs, as well as expanding this program.
Yes.
Supposed to vote on this?
What's the downside of this?
There's none.
Yeah, I mean,
It-
do we need to
it's-
vote on this, or is this just like?
You're just letting us know about it.
Well, so I'm not sure, since it is charging a fee and you guys do set the fee for Board of Health.
Oh, no, we have to set the fee?
Didn't you just set it?
Yeah,
Well, I said that's the proposed rate.
Okay.
That we want to charge.
how much is CPR? Is it, so it's one down from CPR, you're just learning,
You're just learning the Heimlich maneuver, essentially.
Right back to it.
like,
Yeah,
and
so-
how much is a CPR class?
Um,
To just be less than a CPR class, I think it's fine.
yeah, it's way less than a CPR AED first aid class. I think those run at about $65 to $85. And the good thing about this is the city council voted on permanent parklets. So any restaurant in downtown that maybe doesn't have a seating capacity of 25 right now, that is going to have an outside parklet will need, and that increases them over the 25 seat capacity, they're going to need someone on staff at all times that is trained in anti-choking procedures. So our hope is to get this out to them especially.
Okay. I just learned a word. Parklet.
The wooden things that were on State Street, that's all I know them as.
Okay,
So-
so we don't have to vote on it, or we vote on it, or?
I'll defer to Dr. Blair on, and we have Laura Vlasic, the new health director. She is raising her hand. So let me promote her.
Progress.
Sorry, as I raise my hand. You should make a motion to vote on it, and the board should vote on it if so willing to do so. And hello, everyone. I know I don't start till Monday, but I figured I'd join.
I think, so what, do you want to read off These again, and then we'll,
It's $20 for Newburyport. So it's, Michael, it should be someone that, we don't care if they live in Newburyport, it's if they work at a restaurant in Newburyport, correct?
Yep, so it's anyone that works at a restaurant or lives in
In
Newburyport.
Newburyport is $20, anyone else is 25.
Yeah, figuring, eventually maybe you'll have people from Amesbury, Salisbury restaurants that also need to meet this requirement, that might want to take the class.
So, motion to set fees for local choking responder course at $20 for residents or employees in Newburyport restaurants, $25 for others. Is that fair?
and second,
All in favor?
Aye.
aye.
Aye. Okay, so now, is there any general department updates?
Well, on Monday, we'll have our new health director. It will be her first day in the office. She's already
Let's get her off.
Sorry, I have to go through a different menu. There we go. So that's really it. We're excited to have her and get started, and she'll hit the ground running.
Yeah, awesome. So congratulations, Laura. What happened? Why did we, she's off, you took off the panel? So where did she go?
I think we can't, I think there are people that we can't, I don't know how this place works, actually. So Michael, there's other people that we're not seeing, right?
Yeah, in the attendees.
Yeah, the attendee list.
She just moved her to the attendee.
She's down to the attendee list.
Okay, well, anyways, congratulations and welcome, Laura.
Second that.
Yeah, third.
Any other departmental updates?
Not at this time.
Okay. So blood drive?
Yep. So there's two things here. One's not listed, but the blood drive. We've been working with the mayor's office and the senior center and the American Red Cross at the request of the mayor to set up a blood drive. So that will be on Tuesday, May 3rd at the senior center. I think it's 1 to 7 or 1 to something, and they leave by 7. So we're excited for that, and we'll have some volunteers, I think, from the National Honor Society there to help. And so yeah, so that's just that. The other thing that's not listed is the variance request for the waterfront park bathrooms. So essentially, the plumbing code falls under the Board of Health still. And so if you want to get a variance from the plumbing code per Mass state law, you need to apply for a variance from the State Board of Examiners of Plumbing and Gas Fitters. And part of that process is to get written documentation that the board has received the plans for the variance in the application. So that's what I had sent around, as well as a draft letter. And I can pull that up if you guys would like. And essentially all we need to do is vote that it's been received, and then I can send the letter off to Andy Port, our planning director, who can include that in the state variance application. Just saying, we've received it. Here you go.
Works for me.
So I would motion to present that we've received a letter. Is that,
Yeah, I think that's all we need to say.
and Rob, you've read it?
The variance,
Yeah,
I did not read.
What about the,
I did not read it.
Did you read the letter that we proposed to send out?
The email that came before the last email.
Basically, it just
We can pull it up now.
Okay.
I have it right here. Let me just find which screen it is. So here's the actual app. Can you see this? The application. So this is just the application that was filled out, the applicant, city of Newburyport, all the requirements, who's applying, and then a narrative. That narrative was supplied in a supplemental document. This is just going through the proposal, which I had summarized in my email, as well as the justification conforming with Title IX Social Justice Initiative, facilities, caregiving between people of different genders, and one room allowing to maintain any gender maintenance person to access for cleaning. And this is the proposed floor plan. And it was the one on the far left that I had sent to you. So essentially all they need us to do is supply them with a letter, which this is what we have written, saying that it was received, reviewed at our public meeting, and that this serves as their written documentation to go with the application to the state.
So it would be motion to send letter as written.
Yes.
Send the letter, send the letter.
Yeah.
Second,
All in favor?
aye.
Send the letter.
Thank you.
Okay. Now we're talking about the dates of the future meetings.
So I just went in and I listed the third Thursday out in every month, just because there was Northeastern Massachusetts Mosquito Control likes to do a presentation every year to boards of health, and they prefer it to be before mosquito season, so before June. So the next meeting that they were available was May 19th.
Okay, well, I think being the third Thursday, we can go ahead and move on with this unless something comes up that is inconvenient for one or more of us, then we can pick an alternative date. Everybody agree to that?
Okay.
What are we saying?
That
Third Thursdays.
we'll go along with these third Thursdays for now, unless something comes up where it's inconvenient for one or more of us.
Okay, so next meeting would be third Thursday in April. Is that what we're saying?
Yeah, the 21st.
Okay. And the mosquito thing will be the 19th of May.
Yes.
Okay.
And this last thing where I wrote method was, I know there was, I don't remember if it was you, Sam, that brought it up, or who brought it up about Zoom versus hybrid versus in-person meetings going forward. So I wasn't sure if that was a discussion you guys wanted to have at this time, or.
Well, I'm still in my office right now, so I mean it's helped me.
Yeah.
I don't know.
I'm neutral.
I mean, what's the benefit of in person? I mean,
I'm neutral, but to answer your question, I mean, it's nicer to see people in attendance and maybe easier for people to be in attendance.
public, like,
In a public
Yes.
setting, depends on the person, obviously, but some people might find it less intimidating to be on a Zoom. I don't know.
Well, I'm in favor of going, public. For the same reasons that you stated, Sam. And Rob, you find it inconvenient because of where you are and what your work schedule is, correct?
A little bit, but
Why don't we keep it like this for a while?
how about one more? And then we'll,
The April meeting.
The next one, and then, yeah, maybe do mosquito presentation in person.
okay,
Yeah, that makes sense.
Okay.
all right, fair enough.
It doesn't have to be forever, but maybe just say, let's try that one in person.
Okay,
Okay. So unless there's anything else, I propose we adjourn.
motion to adjourn.
Second, sorry.
All in favor.
Aye.
Hi.
Have a good weekend, everybody.
Good night, everybody. Thanks.